My guests are already in here. It's a full house from Carter Center, and of course, Julius Gagawulo. I hope I got her name correct. Julius is here. He's from Carter Center. Joe Benga is okay from the TV control program. Alexander Alexander Jala. Okay, that's Alexander Jala. Benjamin Bala is here, prosecuting for Bill Jala. We from the Cultivation for Users Hope, of course. Caroline Sowambi is a TB clinician, and Achi Pia is a TB survivor as well. He's also part of this discussion this morning. And basically, we will be looking at the partnership with the Ministry of Health and augmenting the efforts of the Liberian government to ensure that we have a safe environment. So I'd like to welcome you all this morning to the program. Beginning with you, Benjamin. That's Alexander Jala. Good morning and welcome.
Yeah, thank you so much for this show. I've worked for the Monserrado County Health Team, and with our partners, Carter Center, we have been working on the TB range project. The implementation of this project in Monserrado County have been a great help for people who suffering from mental health conditions and have TB, and then people who suffer from TB, but then because of the conditions, the stigma and discrimination lead to this. Some of them have some mental health related condition, but with the interventions from clinicians that have been trained by the Carter Center on the implementation of the TB range project in Monserrado County today, many people are attending clinic and getting their medication, and today they are already, some are telling their success story. I think in Cedo we got one guest of us.
So how long have you been partnering with Carter Center?
Carter Center they have been in county working, but under the TB range project from last year, from September last year, they started activity in Monserrado and up to present, and we hope that it continue upward.
Okay, let me hear from Mr. Bill.
Benjamin.
Yeah, Benjamin, Mr. Benjamin Bala. Just bring the mic close to you.
Okay, my name is Benjamin Bala. I'm from Cultivation for Users Hope. Cultivation for Users Hope is a user organization. I mean, people who suffer psychosocial disability, people we call crazy people on the street, and they were once on the street and have recovered and taking medication and are living in good health, managing their recovery and doing meaningful things in society. So that's the background of Cultivation for Users Hope. Cultivation for Users Hope came about in 2010 when the Carter Center came in with the mental health program. So Carter Center mental health program said, but this program would not be successful if you don't have the players themselves as part of it. So they went out. There were two names came up front, like Bill Jala and Sidney K. Flomo. So they had a meeting in Bond County, and then that's how Cultivation came about and got duly registered in 2014 as a NGO for person living with psychosocial disability. And Cultivation have been partners with the Carter Center from the initial time since the project was started, and we are also partner with Carter Center on this project, on the TB Reach project. So that's Cultivation for Users Hope. It's a group of people. It's run. The officials are people that were affected by psychosocial disability, let's say mental illness, and then recover and in wellness. So we are also trying to work along with the Carter Center to make sure that people with psychosocial disability can also contribute to our society and also the world at large. As I said here, I'm also a classroom teacher. I work for the Moravia Consolidated School System as a classroom teacher, and I also work for Cultivation as the General Secretary for this project. So
Good. Okay, let me hear from Alexander Ajala. Alex?
No, this is Joe.
This is Joe. Joe Benga, right?
Yeah.
Joe, you from the TB control program as well, and tell us how do you do your work, and how do you go about identifying people living with tuberculosis?
Okay, so thank you very much. I'm again Joe Bianga. I work for the TB program. As a program, under the Ministry of Health, we are crossed with the responsibility of diagnosing people, in fact, managing TB activities in Liberia. And then, fortunately for us, last year in July, we received a panel. Cancer Center, they came in and then they said they want to also join us to also fight against TB. And then, fortunately for us, we started to train all our clinicians. In Mosurado, they are implementing in about 46 health facility. And then for us to join it or manage mental health and also treat TB, what we did was to also call both TB clinician and also that of mental health clinician. And then they all came together last year in July to October. And then we train almost everyone, about 155 person. And then the rationale behind the training at that time were to make sure that if you had TB, and then if you had TB and then you try to go to a facility, you'll be there, and then you also screen you for mental health activities. And then if you have the both condition, you'll be treated to the same facility. And then those activities, it was done perfect. Where right now in Mosurado County, because their project is the intervention is clearly in Mosurado. So although for the safe facility, we make sure we train them.
Why only Mosurado?
Yeah, right now we are doing what they call almost like a paddle. So if we achieve with the activities in Mosurado, then from there we will also spread out to the other Leeward County. And then again, why Mosurado? Because we have the population in Mosurado is huge. So if we target Mosurado and we achieve, and then easily it will be for us to roll it out in every county. So these are things right now we CHV at a rural community under the catchment of those seen for the safe facility. So now they have knowledge on both TB and that of mental health. Okay. So they are in the community also providing awareness. So people with those signs, people with that condition, with the signs and symptoms, and then they refer to a facility, and then we do the test, and then right after the test, if you meet the criteria, then we place you on a treatment. So these are things right now we are doing, and it's really going well. Although as a ministry, we have been doing well, but then through their intervention, we also found out that our data, our intervention is really improving, and then we really also appreciate them for that.
That's good. Let me hear from Caroline Swambi. Caroline, morning again and welcome.
Good morning.
Uh-huh.
And thank you so much.
Just bring the mic down. I see. Yeah. You can adjust. Yeah, it's okay.
And thank you so much again for this program.
Mm-hmm.
First, I want to be grateful to Cancer Center for the integration, because we were firstly treating TB, and then we saw that the data, even though it was coming up, but from the integrated program from Cancer Center, now we able to rule out more patients. And those patients that will come to the hospital after diagnosing them, if as a clinician, you are not willing to work with them, definitely you will cause depression for them, because the person is already given up. In fact, they are already given up, and they are coming to you to seek hope. So as clinician, you need to put yourself into their shoes and say, yes, this can happen to me, this can happen to my brother, this can happen to other Liberians. So you need to put yourself in the shoes and take care of our patients. And then when the patients come to you at the hospital, in a clinic, there are constraints that you will go through, because just to counsel the patient alone is not an easy thing. You will counsel them well, and then they will go home the next time. That some of our phone don't sleep. If I will say that, you don't switch your phone off, because at times your client will call you at night by 11 while you already wrote the the return day on their card, they will call you at night to ask you, and Alma, you said that tomorrow I should come for my medication, you will be forced to answer them because you want them to take their medicine and you want to work along with them so that we can be able to end TB. So you will have to always talk with them politely. We have been like doing that, and we have been getting on with our patients. We had success patient that I can say, a client, this is my success patient. He came with TB and he's a drugs inducer. But then they canceled it from the clinician. We are 2 in the facility, and all facilities had mental health integrated program. So talking with him, he was able to take his medicine. Not a day that he ever lost. He took his medicine throughout. 6 months, we graduated him, and he stopped inducing drugs for like 8 months now. Yes. So
that
yeah.
is one success story.
Yes, even though we got some challenges in it, but you just need to face it, because there are some of them that will even come to the hospital that they don't even have transportation to go back home. Some will come and tell you that I don't have food. You will have to do some kind of thing like screening your transportation to get them to get the food when they reach home, so they can be able to eat, because the medicine will tell you that you will take the medicine after hour. You can take you can take in food, and then the person will come crying, I don't have transportation, I don't even have food at the house. How will I take this medicine? So you will have to put them in a category that you are fighting to gain success. So you will strain yourself, give them transportation, or give them something to buy food. When you get home, you can buy your food and eat.
Okay, so let me hear from Julius Gagawulo. Julius, I hope I got your name very correct.
You came close, but you're too far.
Welcome, sir.
Thank
So
you.
how you pronounce your name?
So the name is Ngangangro.
That Pele name?
That's a farm belly.
Oh, Ngangangro.
Beautiful one.
That's okay. Okay, that's good. Julius, welcome. You've come from Carter Center,
Right.
and you are the team lead, right?
Of course,
Okay.
for this project.
That's good.
Yeah.
How is Carter Center?
Well, Carter Center is okay. We are great to partner with the Ministry of Health, to partner with all of the stakeholders that we just mentioned, talking about the CFUH, the Mental Health Reporters Network, the National Leprosy and TB Control Program, the Mental Health Unit, as well as the Montserrat County Health Team. So we are grateful, to have the partnership with all of our team. And on the team, I see that everybody is in the high spirit since we started. Last year, we're going like a year, and when we go through the discussion, you got to know some of the benefits that we're seeing now. So we are okay, Carter Center. I hope we are here. Like they always say, they have come to help and they will stay here. So we are here.
Good. So talk to us about the partnership with the Ministry of Health. How did you come in close contact with the Ministry of Health? Maybe somebody out there wants to know.
Thank you. So I will work with the Ministry of Health as an entity dated somewhere around 2008, 2009, when Carter Center mental health program started in Liberia here, partnering with the Ministry of Health. It was a time when in the entire country, record shows that psychiatrists, we have only one psychiatrist in the whole country. Imagine, we're talking about people who have the knowledge and skills to take care of people who have, mental illness, different mental illnesses. If you have one person catering to 5 million human beings plus, think about the gap. So Carter Center realized that it was a huge gap for Liberia. So they came in, and I don't want to talk a lot, but through that success, today we can boast of over 300 up to 400 trained clinicians across this country in different levels of care in mental health. We can also boast about, even at the level of psychiatrists in the country, sooner or later, today we're talking about having 7 trained psychiatrists, and sooner we'll be having like up to 10 in the country. So that's a plus. So, so coming to the partnership in this project, in 2022, the world has come to look for different ways of, in the first place, so let me take you a little back. TB is a very old known disease in the world. One of the oldest diseases that you can think about. TB, the history of TB goes as far back as 3,000 plus years ago. In China, for example, in India, in China, now in the whole world. So it has become an old age, story over and over, and it has killed a lot of people, millions and millions upon millions of people. And so the world is exploring different ways. So in 1882, one doctor called Dr. Robert Koch discovered this disease and said, look, this is a disease, this is the bacteria that is causing the sickness. So, and that discovery was done on March 24. So that's why every year we celebrate March 24 as World TB Day. So then people begin to see, okay, since this is a bacteria that is causing it, let us find ways of finding cure, or treatment for it. Let's find a way of taking care of it. How can they travel from one place to another? How can we stop that transmission? How do we manage people who suffer from it? And so they came out with medication and different strategies. So, fast forward, right? Now, in 2022, the world, through the United Nations, they said, okay, they are sending out requests for application to partners who are interested in helping to combat the disease. So one strategy they brought was that they are looking for ways that somebody can bring about innovation in increasing the number of cases, identifying more people with TB and placing them on treatment, not just providing drugs, but we want to find different strategies. So then Carter Center and Ministry of Health sat together and said, look, I think we can put our heads together. Ministry of Health, you got a good idea in integrating, TB and HIV. You have done it so well. Carter Center, with over 12 years of experience now working in Liberia in mental health, we can partner with you because we realize that most of the patients who now to have good success rate for TB, you must take care of the psychosocial component of the TB patient. Yes, not just about treating, because just by diagnosing somebody as having TB, that alone is a burden.
Sure.
So if we don't take care of that, those patients that we identify, a lot of them will run away because of the psychosocial component. And when they run away, then they become dangerous to the society. They will spread it wherever they go. So Carter Center and the Ministry have decided to integrate mental health into TB care system. And this is where we are today. We started officially in July last year, and July this year will make it us 1 year. But through our connection with our donors, our project has been extended to December until...
Meaning the TV program actually started last year?
No, not the TV program. The TV program...
It started long since.
Because we're talking about the Stop TB, this identical, TB Reach project.
Okay, because the reason I'm asking this is because I was in Bong County. I'm from Bong, and the former vice president of the Carter Center, former deputy SRSG of the United Nations, Jordan Ryan. You can recall when he was vice president for Carter Center. I traveled with him across the 13 administrative districts, and there were people identified with mental health problems, and that was something that actually gave more rise to the Phoebe Hospital to upgrade the mental health institution there in Swakoko district. So meaning there has been this thing with Carter Center has been a long-ish partnership helping to improve the lives of Liberians. So where are you actually getting your support from?
So currently, before then, the Carter Center have been supporting it from their own, support from the Carter family. We must appreciate the Carter family. I'm talking about Omer Jimmy Carter and his wife, the late Rosie, Smith Carter.
Is he still alive?
No, she passed off.
No, I'm talking about the Papena.
Yeah, the Omer is still alive.
So in case he's no more, where will Carter Center be?
So this is where the same question I'm asking the question. But the thing is, this has become a global, initiative. It's not only now about the Carter family.
Okay.
It has become a global initiative. This is why, if you look at this project, we are receiving this support through the United Nations. This current TB project is being funded by the United Nations Office for Project Services. So you see how far now.
The UNDP?
No, not UNDP.
Okay.
We call it UNOPS. UNOPS.
Okay, that's UNOPS.
Yes.
UNOPS has been around for some time now.
Yes. So to tell you that the Carter Center is a global-based, organization. They receive funding from a lot of because of the credibility, and the type of work they do. So in this project, we are now in the front page. Now, I mean, it's just like Carter Center is running it, but no, it's the Ministry of Health that is running it. It's in partnership with the Carter Center. So this is how we operate.
Before I come to Achipia, let me hear from Joe Bianga who wants to add up to what you said, Mr. Nangawulo. Mr. Bianga?
Yeah, okay. So thank you very much. He was really explaining, and then I was really nodding my head. But then as a program, all those things that we are saying, we have what I call a cost sharing. Cost sharing, that is, we have a very responsibility at every level. And then today, our reason of being here, first thing is to provide information on Carter Center, and also that of Ministry of Health on TB activity along with mental health. But then we also want for the public to be informed that when they mention the issue of for the state facility, though we have more than that, but then we want for people who have the sign and symptom of TB to seek care into the very facility. Now, at those facilities right now, we have good news there. One, we have a machine that can really help us and timely detect TB cases. One. Two, if you have non-TB, the drug is available to the facility we just mentioned. And then another good news that I just mentioned is that if you don't have also TB, but if you have also TB, but then your children that you have, they don't have TB, we also have medication that we also give to them to prevent them from not to encounter TB now and also in the future. So we call it TPT. TPT that is, and also they also came in and or provided some funding, and then we train also our clinicians, very facility that if, for example, I have TB right now, and then he is my son, and then he under 5. Since for him, he don't have TB, and then due to his age, we will also give him medication that it will prevent him not to get TB that I have.
So is TB a communicable disease?
Yes, yeah. For example, because if we live in the same route or the same airspace, and then I keep on coughing, and then you are being with me as my child, it's possible. The likelihood is possible. That is, it's possible that you come down with the TB, because if I call without taking the best precaution, you, my child, or my wife, or anybody living with me, it's possible that they also get a TB. So because of that, what now we are doing is that we also have medication to give to people to make sure and prevent them not to get the TB that I actually have. And then so now those services, they are also going on. So we told you what to also provide that information to the public. And again, it's still free. And then the same way the medication for the treatment is free, the same way the medication for the treatment, for the prevention is also free. So we are also providing the information. Even at the community level, if you also have TB, and with the sign and symptom that I think, the sign and symptom that the easier one that people really know is just coughing. If you cough for weeks and what have you, and then you see yourself not too strong, and also your weight is also reducing, make sure and also just ask them to do facility. When you get there, the clinicians, thank God, will even run one. The clinician, it will tell you exactly whether you have TB or not. And then because they will be taking your sample, and then they will carry and test it. If you have TB, they will tell you. If you don't have, they will also tell you. So these are just a few information also try to also add to what you also saying. Thank you very much.
Okay, good. I will come to you, Mr. Yala. Let us go to one of the persons who has survived from TB. I heard Caroline speaking about that. I don't know whether he's the person, but morning again.
Yeah, good morning.
Can you? Okay, thank you so much. The Liberian people are listening to you. They want to hear your story. How did you get TB? What led you to get it? When was that? And how old were you when you got TB? And how old are you now?
Well, I'm Archie Peter from Trials Market, Barnumsville. Well, I was 27 years. I encountered TB. I encountered TB through taking drugs. I was involved in the bad substances, taking substance that are not of me, So I was involved into the street. I got into the street. I took drugs. Let's say what the people can call cocoa and tar.
So you people started the cocoa and tar business. That was which year?
Well, I started taking it 2019.
Hmm.
Yeah, 2019.
And how long did you go with it?
I stopped it last year.
2019 to 2023.
2023, yeah.
Hmm.
Stopped it last year. But then, when I decided to stop it, I decided to go back home. When I went back home after a few days, like not a few days, but month, I started getting sick because I never took any treatment like going to rehabilitation center to rest. So I got sick at my house. When I got sick, I started trapping weight, coughing. So one of my uncle in the community decided to take me to GFK. When I went to GFK the first time, they did all of my tests, but then that day I couldn't even cough. I started strain myself to cough no way. So the doctor there gave me a cup. Say take a cup home, cough inside and bring it tomorrow. So it was on a Friday. I took the cup home and then I coughed. Saturday morning I carry it to GFK. When I got to GFK I gave it. They said I should go back Monday again. At that time I'm telling you I couldn't even walk from the gate to go to the cold clinic to GFK. I would be too tired, sweating as if to say I don't walk 1 hour distance. So that morning when I got there, they did a test. They told me, "Oh, you got TB." I was like, "TB?" Well, I was starving. I broke down. Actually, I broke down.
Hmm.
Yeah. But then I sat down. I asked the woman again. I said, "But ain't you can be treated?" She said, "Yeah." But now the medicine not yet. Medicine not here again. Then where I can get the medicine from? She said we got other people having the medicine, but let me call in fact where you living? I said, oh I live in Trials Market. She sent a panel, let me call Keba. She called Keba, no way, she called Bible and no way. But then she said, I got a friend of mine with Cali. But let me call to ask her if they having medicine. And she called Dr. Carolina. She called Dr. Carolina. She gave me her number. I said, call her. I said, oh man, the GFK, oh, your friend get a number of me. But then I having TB. But she said I should call you to come to you for treatment if you got medicine there. She said, yeah, come. I said I should come today. She said, yeah, be able to come right now, come. But actually, I never had money at that moment. So I went back Balance. I took money from the mom. I went to her. When I got there, she asked me, oh, why you can't do it? I started to explain. I told her how I got there. I said, oh, I was taking drugs. I was sleeping in the street. So I got it cool. She said, no problem. She canceled me. In fact, when I even saw the medicine she gave me to even take water to take it, I breathe down again. The medicine PB. For the medicine to pass through a throat and small thing.
Hmm.
So you gotta get up 5 o'clock, take the medicine every day. 6 more. I even hear the 6 more again. I said, what? 6 more? I thought you were eating 6 more. I was eating. My whole throat, right? The whole food I even need to pass every day. So I asked God, I said, God help me, let me take advantage of this medicine. I started taking the treatment. They gave me the medicine for 2 weeks. Before 2 weeks, I took it. I went back there, they gave me again 2 weeks. Took it. I went back there, they gave me 1 more. I took it. After 2 months, they take my first test. You got the first instruction they gave me. They say when you go home, you and people shouldn't be together like that. You shouldn't eat together. Take back from the same bucket. When you take back in the bathroom, waste water. So I started going by the instruction. My mom, in fact, my mom was sleeping. So I started taking the medicine. When I went, they say you're not eating with nobody on the 2 months. I went there. I started doing it. I used to cook my own food. I cook my own food. I sit down, eat it, I finish and go inside. I left on it 2 months. When I went back, they take my test. It is I had to change the medicine. I had to give me a smaller one. I started taking it again. Get out, it's in 5 o'clock again. Take it. Started taking the medicine one day. By the time I go to 6 months finish, I went there. They came on hospital cover, say, oh, you graduated from the treatment now.
Hmm.
You can live your normal life. And since that time, I've been feeling fine. My left foot and all was falling. They cool. I never used to walk on the free day. I used to be sleeping. I'm walking, I will be laying one side. I'm even laying now.
But you're okay now. Everything is okay.
Everything is okay. And thank you for the woman.
Okay.
Yeah,
She's-
a very strong clinician. She knows how to talk to people. If it hadn't been for her, I wouldn't reach the far, I swear.
Hmm.
I need to-
When JFK that day, I come to really there from myself, they didn't play. But,
So some of your friends are doing the same thing you're doing. What could be the advice from you as a young man to those of your friends? You have women, you have young girls and young boys. They are in the street and they are doing worse than you.
yeah, I would just like to encourage them to make up their mind, because if you got a face mindset like me, I was taking a job, but then I used to tell myself every day that this is not of you. Actually, you got a disease from it. You're not the kind of person people used to know. Why you be doing that kind of thing to yourself? Asking people you're not even supposed to be asking for money. People that are supposed to be asking you, you asking them. People you're supposed to be working for you, working for them, doing things that are supposed to, like you're supposed to be in schools and if I ain't working.
So you were in
Yeah.
between abnormal stage as well,
Yeah,
because you were doing things abnormally.
yeah. So then I would sit down by myself and cry.
You had a mental complication.
Say, Grandma left here, God help me. And I used to tell myself that today, the one day I will just stay away from anything, I will not go back to it. And since last year, June 23rd, I decided not to go up. Since June 23rd last year, up to today, I'm put substance in my way. So I just encouraging my friends out there too. They can do the same. And when you leaving the substance, I encourage them also to go do the TB test, because leaving that substance, you smoking the substance, the signal in you, but you can't notice it because you're taking the substance. But once you leave that substance, you start getting sick. And some people will not know it's TB or whether not TB, and then they will kill them.
I also learned that it makes people very black.
Yeah, it will make you black because you're taking back. You
So
know,
when you're taking that thing, you don't think about bathing, and water is all over the place.
yeah, you don't.
So when you
think
take bath,
about
what will
it.
happen to you?
Nothing will happen.
They say when
By
you
the
take bath, the
time
drugs will move on in you.
No,
Hmm.
it's not that the drugs will move on you.
By the time you're taking bath, your
Nah,
friends are in the
you
ghetto
take bath.
already.
First of all, couple of young guys, young ladies on the street don't even stay at home. So here is the challenge. You not do your where you will be.
Because
Oh, okay. Peter, thank you. And it's a very sad and a glorious story. And hope that the young people will listen to you. I see a couple of them, even in my own county bone. The last time I was there, I met some of them. We were in school. They are doing just differently, negative, and hope that they will listen and they will recuperate and their lives will be better like you, because I know you are a successful young man now, handsome young black man. And good, and congratulations to Caroline, Dr. Caroline. Zombie. I didn't know that you are a Dr. of TB. Okay, Mr. Yara, you want to say something?
Yeah.
Because we'll be opening the lines very shortly
Yeah.
to interact with the public.
Yeah, thank you very much. So, you see, when he was explaining his success story, so the importance of integrating mental health and TB together, because the first time he came in contact with the clinician, when they gave him the medication to accept, he found it difficult to accept. There where the counseling come in, they start to talk, and because of that, it made them to sit sad. they worry plenty, then they start to develop. If it lasts for certain length of time, then the mental health conditions try to come in. Because if you say, sir, lost interest in pleasurable things that you used to do, you no longer have interest in it, and then those things that you always used to interact, people that you're going around, you no longer going around, then you also yourself in that way, then the clinician have to come in. But with the help of Carter Center, training a clinician on both mental health, how to identify mental health conditions, how to identify people who suffer from TB, whether depression or anxiety or other mental health related conditions, they can be able to work with them and help in the process a lot. The psychosocial aspect, the counseling, making him to a help to the treatment, meaning the person, once they get in that psychosocial support, then the family come in, will start to talk to the family. Because of the conditions, the family will do away with the person. They don't want to interact with them. So in Monserrado County, in the 46 health facility that Carter Center carry on implementations along with government in that facility, I will tell you that people now, even in the catchment community, with the awareness, with a lot of educations on TB, how to control it today, our population, if you look at the trend of the data, is increasing. People are going to seek care. Thank you so much.
Mr. Bala, you want to add up?
Yeah, when Peter was talking, Mr. Ayala just said, so that's the work of cultivation for use also, because right there he was in a state of psychosocial problem, or facing some psychosocial problem. I mean, find it difficult to accept, like Mr. Ayala said. So that's one of the things that even has some of us relapsing 1 or 2 times, because we find it difficult to accept our condition. You remember somebody calling in Liberia, somebody says that man pie wire pop or they man crazy. You don't want to accept somebody calling you that name. But when you accept your condition and you take your medication rightly and you work along with the clinician, you can do better. I was attending the University of Liberia and I had this problem. Remember, I entered to do civil engineering. So I did the physics 105, 106 and everything. But then critical thinking, and every time you have to do more math, you got to do a lot of calculus. So I said, no, I can't be doing the kind of thinking. I already have this problem. So I had to switch to be in the numbers. So I want to do accounting and economics. And I did it successfully and I graduated in 2004. So you see, somebody with mental problem can also go to school and be useful to the society once you are given the needed support. And currently, we are on medication. We take our medication rightly, and we appear before people. In fact, people will tell us that Carter Center can pay us to lie on ourselves. I always say, I call it, the songwriter say, your wahala will make room for you. The same mental problem have carried 2 of our colleagues to the state in a day, or they are peer specialists in the country, came back to work for the government and also work for other people like their peers. But because of the state of our government, you see that they are not in the health system. But we are working together along with the Carter Center and making sure that these things will work on one day.
Yeah. Okay, Caroline.
Yes.
You heard Peter expressing a lot of joy over his his trauma healing.
Yeah. You know, for mental health and TB, we take in our treatment supporters. Actually, treatment supporter play a lot of roles in Ati's success story, because he was ready to pay Ati way to come and get his medication. As Ati leave his house, he will always call to do follow-up. So our treatment supporters are key, because if there is no treatment supporter, we are not at home, even though we call to check on our clients. But if the treatment supporter is not ready to help in that situation, he don't have the medication and give to the person in the morning, or either be with the person always concerned about the person the way our chief brother did, then we cannot have success story, because we are not at the very homes to do that. We only give you the medication and we'll be checking on you. As you come, we will see your condition and we will counsel you. But then what about the home? If people are rejecting you from home, If people are not there to pay your way to come and get your to get your transportation and come to get your medication, how will you be successful? So because of those reasons, we don't have a good treatment supporter. Sometimes our clients will lose. They will lose. So we also saying it to our treatment supporter too. Before we become successful in the treatment, or your child becomes successful, we need your support. We need your support. Because if you are supporting us morally at home with transportation, we will be able to be successful.
Good. Mr. Ngangaulo, Carter Center is getting a lot of commendations, and you are operating 46 communities, catchment communities, right?
No, facilities.
Facilities. Okay,
Yeah.
right. Facilities. And Liberia is not Monrovia, or Monrovia is not Liberia. Other communities are infested with these health complications. What is the plan of from Carter Center in?
So, the Carter Center remains open to continuing this engagement with the Ministry of Health, with all of our partners. We are hopeful that our donors will see reasons to continue to work with us, to expand. Like you said, we started the project in a kind of a research base, something because we want to show something out there. So we took another county, Nimba, as a control, where we're not actually doing anything that we just monitor. We want to show, reasons that where we are doing this intervention, right? Integrating the services, mental health into TB, there will be better results. And so when we show that result, taking the control county and the intervention county and showing the difference there, we are hopeful that our donors will see reason to continue to work with us, so we can extend, or we can now go outside most of our county, the rest of the other 14 counties. We got TB patients there from all across this country,
Of course.
who need the same support and services.
Okay.
So it's our intent to go out there.
Okay, let's take a few calls, and we will be leaving very shortly. 0772-876481, 0772-876481, or you call me on this alternative line, 0886-324-740, 0886-324-740. You call and speak your mind this morning. My guests are in here, and they come from Carter Center. They come from the TB, that's the Ministry of Health, Mental Health Unit, Cultivation for Users Hope. They are from different areas, and one of the survivors of TB is here, who told you that people don't survive from TB. One evidence is right here, and we are screened live on the LNTV Liberia live page across the world. Morning, sir. Go ahead.
Yeah, good morning. I'm Heron Logan from Nikuta.
Go ahead quickly.
Okay. I'm very glad to hear this information about TB in Liberia, because a lot of our people, our friends are dying from TB due to the poor treatment of in Liberia. So to hear this information, I'm happy. But there are a few questions I want to ask.
We will just give you time to ask one, because others are on the line and we don't have much time.
Okay. Yes, because while they did it, thing you have TB to transport. Sometimes they transport you to where the medication is. Sometimes you have the TB, then you get on keke or NM or the motorbike or anything to get where the treatment is. So in that movement, when you cough, or maybe someone will be there, a passenger that are going to. So when you cough, because it's a transportation, you can transport the disease, can transport. Oh yes, the transferation of disease. So if you cough, then the other people will be with you. Then they also.
You go on? Yeah. Oh man. Anyway, I think they heard something from there. Morning.
Yeah. Good morning.
Morning. Quickly.
Yeah, this is Josh speaking from Bolon Fund.
Quickly, let's hear you.
Yeah, I just want to tell the student guys still there, and I want to ask them where are the places and they have people that think like you are speaking one of my email by the name of my house live on the Johnsonville, like the email. Yes, over there. In your contact with the student, I received call from them, so I decided to go there on Sunday. So my farm place to carry him.
Okay.
So this is what they do and get it on the farmer.
Okay. They will speak to that. Let me take this person. Morning. Good morning.
Good morning, sir.
Good morning, sir. Go ahead.
But I think
Mm-hmm.
I'm interested in this discussion because I'm victim of it in the sense that I lost 2 family members from TB. And now we're taking care of the GSK hospital. The latest is my older brother who passed off for this because the drugs that was given was not the drugs intended for TB, and they never went through the process with the X-ray. And today he gone. So I want to say to those doctors and others listening to me, if a patient went to your hospital, do the lab work properly. But if they have a person, do the person has business doing with community radio stations across the country, because the community radio stations are widely listened to by the locals in those counties.
Okay. Thank you.
Business with them.
Thank you. You can address the concerns. He's asking whether Cattle Center has a business doing with community radio stations to sensitize people about where they can go when they have TB.
Definitely.
So that's the question he
So,
asked.
so yes, I want to assure him that this talk show will continue every month, and this is one platform we want to use to provide more awareness, more education to our people. We're going to be going over some of the list of facilities that we have, that the caller who mentioned about Johnsonville. So I just want to let the person know that if you go to Johnsonville clinic now, there's a clinic right around the police station or around the cemetery. A clinic there, that clinic is providing TB services. If you go to St. Benedict Many, where the lady Caroline is from, they also provide free TB services. You go to Puebla Health Center, Omega Community Clinic, and that of not Bannerville, but Mount Barkley Clinic. So those are all facilities around that person, so they can take advantage of that. But yes, on the issue of awareness, we started providing awareness even in targeted communities. We're using mobile, PA system in a clinic. In some open bar pickers with clinicians on board, providing education to our communities and even doing community screening on TB. We are taking specimens from people and testing them. And all those that we are identifying positive through that line, we are also placing them on treatment.
Okay.
So yeah, we are going out to the people.
Quickly, we don't have time, so I'll just go across the table, but just come in with your concern.
Yes, let me just respond to the person that just asked question about transporting a patient from one facility to another. Yes, so don't be afraid. Prior to the person being positive at any facility, the person has already been in a community. The person has been riding keke, the person has been riding buses to go anywhere, either for conference, attending services, or even school. So now, if the person comes to our facility and then they say you are positive, yes, the person is positive, but know that before the machine say the person is positive, the person has also been living in a community. So the only thing we're gonna do is that when the person comes to us, like even our PM, our colleague who just narrated, along you come to us, we'll also give you health talk. That is in the first 2 weeks. Please be careful because the bacteria is active. They have the ability to spread from one person to another. So since now they say you have TB, please make sure and use your mask, or again when you coughing, please cover your mouth. So the person right now can get to move from one facility to another due to either medication or due to another care. Like you say you went to GFK. GFK said you have TB, but then we don't have drug right now. So what you do is that let me come and put it from St. Benedict Menin to Portland, and then or they call Caroline. In the process of leaving from GFK to go to St. Benedict, you already have now that knowledge that you have TB. So when you coughing, the person will tell the person now to be careful.
Okay.
Yeah, to cover that mouth and do all those things. So,
Mr. Bianga, finally, just 10 seconds.
Yes. So thank you very much for also allowing us to really sit here. It's an opportunity. And then other people are really concerned about whether we'll be on radio almost every time to provide information. Thank God, again, we are government. Again, we also have the Cattle Center people. Every time, almost by the grace of God, every month we'll be coming, and then we also will be providing health talk. But then the call sharing today is, don't forget, anybody in your house, it could be your neighbor, your brother, even your church member, when they're going through the same thing, that is coughing or they are reducing, please advise them to go to the nearby.
Thank you, Mr. Yala.
Thank you,
Mr. Yala, quickly, just 5 seconds.
Thank you so much for the opportunity given us. I just want the public to know that within the Southern Health District in Montserrado County, there are facilities that are implementing the TB range project in the Southern Health District. For example, Commonwealth, within Commonwealth, you can see care Tupelo, you can see care ES Green Hospital, you can see care to other facilities once it have to do with health-related issue. Yeah, in the Southern Health District, try to receive care to any government facility.
Thank you,
or private facility.
Mr. Bala.
Okay, so I just want to say I'm grateful to the Carter Center and to all those out there. Mental illness can be managed and they can be treated. So you just have to come over, go to Grand Hospital. You are diagnosed. Make sure you take your medication. That's a problem we have with most of our people. Some of them refusing to take the medication. Please take your medication and you'll be okay.
Thank you. Caroline?
Yeah, I want to be grateful for sitting here today. I would like to tell my fellow clinicians and also Liberian at large that even though we have challenges with our clients, but we need to be there for them.
Okay, thank you. Peter?
Yeah, I want to take this time to say thank you to the Carter Center, to the Federal Health practitioners, and to encourage my friends out there that TB can be earned in Liberia.
Okay.
Once you go and get tested, take your treatment. It's 6 months. Take your treatment, and then you go.
Thank you so much, Mr. Ngangangulo.
Yeah. So,
well, yeah.
Studio, thank you so much for this wonderful time. And thank you to all of you, our partners. Thank you for the time, your efforts, your dedication to this project. TB can be cured. TB is a very weak disease, I can tell anybody. We don't have to sit down and our people die from that kind of lazy disease. All they need to do is to, once you coughing, or go to the hospital, go to the clinic and be tested. If you are positive, we will place you on treatment.
Thank you.
Yes.
Thank you so much. But that's how we come to the end of this presentation. Having Julius Ngangangulo, Carter Center, Joe Bianga of the TB Control Program, Alexander Yala, Mental Health Unit, Benjamin Bala, represented Bill Jala of the Cultivation for Users Hope, Caroline Swambi is a TB clinician, and Achi Peter is a survivor of the TB.